are sick of this pandemic. All of us want to spend time with friends and family, but an event cancelled is better than a life cancelled. It's better to cancel now and celebrate later than to celebrate now and grieve later.
WHO Director General Tedros Ghebreyesus there issuing a stark warning. End-of-year festivities can drive infections and lead to more deaths. He also said there's now clear evidence that Omicron is more contagious than any other version of the virus so far. That's why the World Health Organization is calling on people to consider the risk they may be taking. Well, here in Germany, the government is introducing new restrictions intended to curb the spread of Omicron. German Chancellor Olaf Scholz announced the measures after an online meeting with leaders of the country's federal states. Germany's Centre for Disease Control had been calling for maximum contact restrictions to be introduced immediately. But the planned measures will take effect after Christmas. Here is the Chancellor.
Es droht nun bereits die Welle 5.
We're now threatened by the fifth wave. Omicron is advancing in Britain, Denmark and the US. This variant differs significantly from previous ones. According to the experts, it's more aggressive and has characteristics which allow it to get past the protection offered by vaccines. Even those with double vaccinations and those who've recovered face a high risk of infection.
More on this with a doctor and a politician. Dr. Johannes Wagner is a paediatrician and an MP for the Green Party, which is part of Germany's governing coalition. Welcome to DW, Doctor. Will these new restrictions delay the Omicron wave?
Good evening. Yes, well, we hope so. And we will do everything which is needed. And on the other hand side, we also do have to prepare a general lockdown. So in case we need one next year, this can be implemented very, very fast. But for now, with these measures, we are hoping to see a further declining of the numbers. And actually, the numbers are still declining. But we have heard just a few seconds ago that Omicron is on the rise. So that's why the combination of those measures and planning a general lockdown or preparing a general lockdown in case we need one next year is the best option right now.
Why not a general lockdown now? We heard that the Robert Koch Institute is calling for one. Why ignore the experts and pander to people and say, all right, well, we'll just keep it open for Christmas?
Well, because the federal states did not use every possibility they had until now to reduce the contacts. We first need to reduce contacts within the current framework and then see if really the Omicron numbers are rising as fast as in other countries. The most important thing, of course, is to have a vaccination campaign still over the holidays as well, and only with a high number of vaccinated people we can at some point end the pandemic. That's why in our opinion it was okay for now to booster the vaccination campaign, to really strengthen it and to make the people clear that it is very important to get vaccinated very, very fast, to get the booster, and also those restrictions which are actually very, very tight restrictions, but we don't need a general lockdown right now with the numbers declining, but we have to be prepared.
OK. From March, German medical workers in hospitals and nursing homes will be required to be vaccinated against COVID. Should this be extended to the general public?
In my opinion, yes. We have to close the gap of people who are not vaccinated, because this is the only measure to get out of this always again coming waves of pandemic waves of coronaviruses. And of course, we also have to have in mind that this global pandemic is only over if it's over globally. We have to also raise numbers of vaccinated people in other parts of the world. We have to support other countries in the world to get their population vaccinated. But also in Germany, we need higher numbers of people vaccinated. And as far right now, we did not have succeeded with the options we had. So in my opinion, yes, we need a mandatory vaccination next year.
And how would that work? Would you say you have to get vaccinated or we will fine you or we will put you in jail? What would you do?
No, we will not put people in jail, but of course a fine could be a possible measure if people are not vaccinated, or to have certain enter restrictions in place for the whole year, for example, like the restrictions to only get into certain stores if you are vaccinated or recovered. Those are possible measures to implement mandatory vaccination. But of course, we have to discuss this mandatory vaccination campaign in the Bundestag, and there we have to exactly define what kind of measures could be, what kind of restrictions could be possible.
Understood. Thank you so much for joining us, Dr. Johannes Wagner, a lawmaker for the Green Party in the German Parliament.
Thank you.
Meanwhile, US President Joe Biden has announced new measures to tackle the pandemic. A major part of that will be the purchase of 500 million rapid tests. They'll be delivered to Americans for free when they order through a new website. It means they won't have to pay for the tests themselves and then hope their health insurer reimburses them. The president also plans to deploy an additional 1,000 troops with medical skills to help overstretched hospitals. Here's some of what he had to say a little earlier.
If you're not fully vaccinated, you have good reason to be concerned. You're at a high risk of getting sick. And if you get sick, you're likely to spread it to others, including friends and family. The unvaccinated have a significantly higher risk of ending up in a hospital or even dying. Almost everyone who has died from COVID-19 in the past many months has been unvaccinated. All these people who have not been vaccinated, you have an obligation to yourselves, to your families, and quite frankly, I know I'll get criticized for this, to your country. Get vaccinated now. It's free. It's convenient. I promise you, it saves lives. And I honest to God believe it's your patriotic duty.
Patriotic duty. Let's explore that with Dr. Amesh Adalja, who's a senior scholar at Johns Hopkins Centre for Health Security. He specialises in infectious diseases and pandemic policy. Welcome to the day, Doctor. More vaccines, 500 million free rapid COVID tests, but no lockdown. Is that enough?
I do think it's enough. When it comes to lockdowns, you have to remember that they are very limited in their usefulness because they are very hard to comply with and they have negative cascading impacts that will have repercussions on many parts of society. So we want to remember that this isn't March of 2020. This is December of 2021. And we have much better precision-guided tools to be able to limit the impact of Omicron, and it's particularly on our hospitals, than we did back then. So I don't think that we need lockdowns. I think what we need to do is more testing, more vaccinations, antivirals, monoclonal antibodies. I think that's how we move forward in this new phase.
And this latest cluster, if I can put it that way, this latest cluster of new measures from governments around the world, this is being driven by Omicron. How is this new variant changing this pandemic and the response necessary?
Well, we always knew that this virus was going to mutate to become able to get around the immunity from prior infection, the immunity from vaccines, and that's what Omicron represents. And I think now it's time that we start to focus on what really matters when it comes to COVID-19, and that's preventing severe disease, hospitalization, and death. That cases are always going to be there because this is not a virus that can be eradicated or eliminated. Our goal is to tame it, to make it much more manageable. And I think Omicron has accelerated that process because we're seeing so many breakthrough infections occurring. This is something we're all going to get, and we have to learn how to risk calculate and learn how to differentiate between mild breakthrough cases and what really counts, severe disease, hospitalization, and death.
So I keep hearing people saying that we're just going to have to get used to living with COVID, as you've done there. So what does that look like in future? Is that just more mask wearing and more boosters and more social distancing from here to death?
What it means is that we now have another respiratory virus that we're going to have to contend with every year, just like we contend with flu and RSV and the whole host of viruses that cause cold-like syndromes. But what will happen with COVID-19 is it will become tamer as we get more of the population immune, as we get more tools like antivirals, such as the one Pfizer is developing, or monoclonal antibodies, and more rapid tests. And we get better at making smart choices and risk calculating. But there are going to be some people that continue to wear masks for some period of time. Others may not. But it's going to be something we have to deal with in a way that I think most people haven't really come to grips with. And I think if you look at the very beginnings of this virus with an efficient spread through the respiratory route, an animal host, it was never going to be eliminated or eradicated. And I think the world was done a disservice by people not being honest about this becoming an endemic virus that was not going to be eradicated.
But it's interesting that you talk about this being endemic, which I think lots of us can see how that's going to be the case. But you use the word tamed there. So it's going to be with us, it's going to be around us, but you seem to imply it's not going to be as deadly, whereas it's been the opposite. It's become deadlier and faster. So you see it peaking and then dipping.
Right. And what's going to make it tamer is probably nothing that the virus does. We're going to make it tamer. We're going to make it tamer by getting vaccinated. We're going to make it tamer by having antivirals. We're going to make it tamer by having monoclonal antibodies. Medical science is going to be what tames the virus. It's not the virus itself that gets tamed. It's our ability to cope with it improves to such a degree that it's not something that can kill at the rate that it could.
And President Biden's message was get vaccinated, get vaccinated, get vaccinated. According to the CDC, 61% of Americans of all ages have been vaccinated. Is it possible this far into a pandemic to identify those who are still reluctant to get vaccinated? Do they fall into any particular social, ethnic or political groups?
Well, what we find is, unfortunately, our pandemic response has been very tribal, and people in one tribe particularly have not really been forthcoming with wanting to get vaccinated. So if you look in the country, these are pockets of places. Unfortunately, it's males. It tends to be Republicans. That's the problem that we see, and I think it's because politics has been so infused into this pandemic response. But hopefully, former President Trump just a couple of days ago talked about himself getting a booster vaccine and advocated for the vaccine. Hopefully that starts to move the needle into people's arms, especially his supporters, who are the main holdouts. But it is very, very difficult now. It's become something where people are very dug in, and it's hard to see an easy solution other than talking to people on a one-on-one basis and trying to persuade them that the vaccine is the right thing for them to do because it will benefit their lives personally.
Fascinating. Thank you so much for joining us and sharing your expertise, Doctor. Dr. Amish Adalja from Johns Hopkins Centre for Health Security.
Thank you.
Well, in the United States, Omicron is now the dominant variant by far, according to accounting for 3/4 of all infections. Just a week ago, that figure was 1 in 8. In New York, virus cases are surging just ahead of the holiday season gatherings.
5, 4, 3, 2, 1. Happy New Year! Woo!
This is just a test. New Year's Eve in Times Square has not come early, but the Omicron wave has hit the US sooner than many experts expected. Nearby, New Yorkers line up to get tested. With Christmas just days away and cases surging, many are worried.
It definitely feels like that first wave of the pandemic with that anxiety, all these long lines around the city, people getting tested, exams are getting canceled for people in grad school like myself. So it kind of feels like that early part of the pandemic where we didn't really know what was happening.
I think we've all been affected. As a New Yorker, we're trying to take every single precaution that we can. Got double vaxxed, boosted, regular testing. I am planning to travel for the holidays, but depending on the result of this test, I'll probably stay put in New York.
America's top pandemic advisor, Anthony Fauci, though, had a hopeful message for those worried about the holidays.
You can go the extra mile and get tested before you have a family gathering or a group. Get tested the day before or the day of getting together. But vaccinated and boosted people, when the family members are vaccinated, should feel very comfortable in getting together and enjoying a holiday meal or a holiday get-together.
Despite the worsening situation, in Times Square, some people were still in a festive mood. But this might be the last time New Yorkers see these lights in person. The mayor still hasn't decided if New Year's celebrations here will go ahead.